Good evening, dear friends. I am Dr. G.S. Kohli, a consultant physician practicing in Joy Nursing Home, Rajouri Garden. I am MBBS and MD from Maulana Azad Medical College, Delhi University. Today, we are going to talk about hypertension or increased blood pressure. Now, first of all, let's see why we want to talk about hypertension or blood pressure. First of all, the magnitude of the problem. Hypertension is so common, prevalent in India, and if not treated, it leads to some fatal complications. So that's why we need to know about this disease. And by an estimate, India has got about 29.4% prevalence of hypertension. And you will be surprised to know very few are actually controlled. Only 8% are controlled hypertension. This means 92% of the hypertensives in India are not controlled on medicine. Maybe because they are not regular in taking the medicine, because they don't have much symptoms, so they don't take the medicine. So after seeing the problem of hypertension and the magnitude of the problem of hypertension in India, let's see what is a blood pressure. We all know that blood flows through our blood vessels from the heart and it goes to all the parts of the body. And the pressure this blood exerts on the wall of the blood pressure is called as blood pressure. When the arteries become small or narrow, or because of the deposition of the cholesterol or lipids or fat, they become narrow, so the pressure of blood flowing through them increases, and this leads to hypertension. So when we check the hypertension, we take two readings, we all know, the upper one and the lower one. The upper one is known as systolic blood pressure, which checks the blood pressure during the contraction of the heart. And the second one is known as the diastolic blood pressure, which checks the blood pressure when the heart is in relaxation. And we write it as, let's say, 120 by 80. So this means 120 is the systolic blood pressure of this patient and 80 millimeter of mercury is the diastolic. And measurement of blood pressure is very simple. We need just a stethoscope and an instrument called sphygmomanometer or BP apparatus to measure the blood pressure of any individual. But there are some individuals who, when come to the clinic, their blood pressure is normal, but when they go home, some time of the day, their blood pressure increases. This is known as masked hypertension. The hypertension is masked in them. And there are some other patients whose blood pressure remains okay at home, but when they see the doctor, their blood pressure rises. This is called white coat hypertension. So to pick up these patients, we have got a system of monitoring of the blood pressure continuously during different types of the day at home. And this is called continuous monitoring of the blood pressures, CMBP, which should be done if you have any doubt that this patient has got blood pressure, but when he comes to your clinic, his blood pressure is normal. You must tell these patients to undergo CMBP, continuous monitoring of the blood pressure. Now coming to the symptoms, most of the patients of blood pressure or hypertension do not have any symptoms. So that's why we miss many hypertensives, because they don't have the symptoms, they don't go to the doctor for getting their blood pressure checked, and even if doctors tell them you take this medicine because you have hypertension, they don't take. They say we have no problem, we have no symptoms, why should we take the medicine? And ultimately they land up in various complications. So what is the definition of hypertension? So we have fixed a criteria that any blood pressure more than 130 by 80 is called hypertensive. But we start the medical treatment when it is more than 140 by 90. So this means between 130 and 139 systolic and diastolic between 80 and 89, we tell them to follow simple lifestyle modifications to control their blood pressures, like exercise, proper diet, and less of stress, which we will be talking later on. But once we see the blood pressure is more than 140/90, we must give pharmacotherapy or medicines to these patients. So having diagnosed hypertension, then third topic we should discuss is who are the patients who are more susceptible to have this high blood pressure. And these patients are, number one, obese patients. Patients who have got more weight, they are more likely to have increase in the blood pressure. Secondly, those who have got family history of hypertension. For example, any sibling whose mother, father, parents or brothers, sisters are hypertensive, they are more likely to have hypertension. Third, dietary habits. If the patient is taking very high fatty diet or taking very high quantity of salt in their diet, again they are more susceptible to hypertension. Then patients taking processed food, because all processed foods do have extra salt in them, so they also tend to have hypertension. Patients having stressful conditions, mental stress, this is again a very important cause of hypertension. So if you get such type of personalities in your clinical practice, you must check their blood pressure. And I tell you, 95% of the patients do not have any cause of hypertension. They are caused as essential hypertension. Only 5% has got some defect in their body, like renal disease, which causes hypertension. Now, next question comes, why should we treat hypertension? Even if the BP is high, why should we treat it? Answer is very simple. If the blood pressure remains high for a long period of time, it adversely affects three organs, remember, and these three organs are very vital for our body: brain, heart and kidneys. In the brain, it is the commonest cause of stroke, or what we call as paralysis. Patients of hypertension are twice more liable to have brain stroke than a non-hypertensive. Second organ which is very important, which is affected by our high blood pressure, is heart. And I tell you, two things it does to the heart is it can cause heart attack or it can cause heart failure. A patient of hypertension has 3 times more chances to get an heart attack and 3 times more chances to have heart failure. And both are, I tell you, and you all know, are very fatal complications. And third organ we were telling you was kidney. 70% of end-stage renal disease or end-stage kidneys are because of either hypertension or diabetes. So we must control blood pressure to save our these 3 vital organs, that is brain, heart and kidney. Because I tell you, the treatment of hypertension is cheap. Patient has to take 1 or 2 tablets, that's all. But if he gets any of these complications involving these organs, it is not only fatal but economically a big burden on the patient. Because if the patient gets renal failure, you can imagine the cost of hemodialysis in these patients. If the patient gets a heart attack, he is admitted in ICU, gets 1 or 2 stents, you can imagine. He has to spend lakhs of rupees for the treatment. Similarly, if there is a brain involvement in the form of stroke, these patients are admitted in ICU, have to spend lot of money, and even after spending lot of money, sometimes they still cannot get out of bed, not able to walk and resume their normal activity. And in all these 3 organ involvement, the quality of the life of the patient suffers. He is not able to do his proper work and earn money. So having seen why we should treat hypertension, now the last question comes, how to treat this hypertension? As I told you, the personalities of the patients who get hypertension, so we have first resort to lifestyle modifications in these patients. And what do you mean by lifestyle modifications? How a person eats, how he does his exercises and how he spends his time. And the foremost thing in lifestyle modification is physical exercise. And the best physical exercise for a hypertension patient is brisk walking. Person should walk at least 30 minutes a day for 5 days a week. This means a combined of 150 minutes of walking per week. He can take 2 days off, let's see Saturday, Sunday, but 30 minutes every day. Second, after physical exercise is the diet. Now what precaution he should observe in diet? As I told you, the salt is a very important thing. So he should cut down the salt in the diet. And when we talk about cutting down of salt in the diet, of course you cannot eat your meal without salt. So what we recommend is you can add little salt, and we recommend about 2 to 2.5 gram of salt per day for these patients, and that too, this salt should be used as a cooking salt in the sabji he takes, in the dals he takes, but he should avoid taking any table salt. Table salt is not allowed in hypertensive patients. So this means he should not add any salt in his roti like parathas. He should not add any salt on the salads, or he should not take any salty things with the tea or as snacks. But he can take cooking salt, and that too 2 to 2.5 grams. So this is second. Third, he should cut down the fatty component of his diet. So he should not take fried things, fatty things in his diet. And what should he then take? He should take more of cereals, fruits, vegetables. So this is called as DASH diet. Diet against stopping hypertension. And next is, what else he should take in the diet which can prevent this? He can take plenty of nuts also. And he said potassium rich foods. And what are the potassium rich foods? Coconut oil, all fruit juices and other fruits. Then another thing he should avoid in his daily activity is smoking. Very important. He should not smoke. He should not take alcohol. So this is about the diet and lifestyle modifications, exercise and proper diet. Then third, stress relief. Patient should avoid physical stress by resorting to yoga, meditation, or if he is not getting proper sleep, he may take some mild anxiolytic agents also. Now, if in spite of doing all this, his blood pressure still remains high, we have no option but to start the medical treatment. And we have got various medicines which are very effective, and we put the patients on these medicines irrespective of the symptoms of the patient. If the patient is asymptomatic or no symptoms, but his blood pressure is high, he has to take these medicines. And while prescribing medicine, we should see that if the patient is not controlled with one drug, we call the patient after a week or 2 weeks, we add a second drug. It is seen that instead of increasing the dose of one drug, we should add small doses of 2 drugs which has got better effects and without side effects. Because if you give small doses of any drugs, there are not going to be much side effects. So we have got very safe and good combinations available of small doses of 2 drugs, and we can prescribe to these patients. And last important thing, your job is not finished once you have started taking medicine. You have to go for regular follow-up, because you are not getting your blood pressure checked up. You are just taking the medicine without realizing whether your BP is controlled or not. So you must go regularly to the doctors whenever he asks you to come and get your blood pressure regularly checked up, because it may require increase or decrease of the dose of the medicines. So dear friends, now you know the importance of hypertension and why you need treatment for this disease. If you want to live long and live a good quality of life, so first change your lifestyle and go to your doctor regularly and take his advice, because by doing this you will live longer and without any problems, and you will be having a very good quality of life in spite of having this disease. Thank you.